Hi, my name is Manan Shukla, and this is Dr. Oshani. And today we're going to be showing you a project that we've been working on called EMSights, which stands for Emergency Medicine Insights. Now, our goal as health informaticists is to always provide our physicians with the right information at the right context and at the right time. Now, the funny thing about being an ER physician is that when a patient comes into the ER, there's no information about a patient. There's no context as to what the patient's been through or what environment the patient has been in, and there's absolutely no time that the physician has. As a result, we've created this system, and let me tell you how it works. First of all, we have setup, where the patient consents way before the emergency even happens to transferring their data to an ER physician in case of a life-threatening emergency. Now, during the emergency, what happens is ER physicians and EMS personnel will authenticate with EMSights to get access to the patient's medication records, clinical notes, as well as other pertinent information. And after authentication is done, EMSights will then handle data extraction through FHIR servers and present relevant information or relevant insights in a dashboard to this provider, so that even if you give this physician 30 to 40 seconds, he or she will have enough information to take action on the patient. All transactions are recorded on the blockchain to ensure transparency, and all processes are facilitated through smart contracts.
All right, so this is the EMSights architecture. A key component of this architecture is the Ethereum blockchain, which is at the lower part of the diagram. And Manan mentioned about the patients having to give their consent. So the patient consent is handled through a smart contract. And on the other side, we have EMS personnel and ER physicians who also have to authenticate and authorize the request to access the patient records. So that's also handled through a smart contract. And then once all these things are in place, we have another smart contract to deal with the FHIR data retrieval. And for that, the system will talk to FHIR-based EHR servers as well as personal health devices, IoT devices. And then EMSights will do the FHIR resource processing and extract the relevant insights from the data and then present it to the physicians in a dashboard so that they can have actionable insights in a very short amount of time. So next, we are going to show a quick demo of the system, or rather the prototype. So on the left-hand side, we have the timeline that has some of the key events of the patient's medical history that are summarized in an easy-to-consume manner. And then in the middle column, we have the patient's EKG lab report, as well as drug compliance that was captured by a smart pill bottle. And then on the right-hand side, we have the patient's information as well as medication list, and we could include things like the patient's allergies, etc. So this work is currently available in our GitHub repo, and we welcome you to try it out and let us know what you think. With that, we conclude our presentation. Thank you very much for your attention.